Here we are again for another EXO on the couch. Today we have Alan Forbes with us, who is the CEO of the Patient Experience Group. Alan has also recently written a book called The Patient Experience, The Future of the Healthcare Industry. So we're really looking forward to getting some information from Alan today. But welcome, Alan. It's your first time on the couch.
It is, and thanks very much for having me, David. It's great to be able to speak with you about the patient experience.
Excellent. Great to have you here. So, let's just get started a little bit about yourself, your history and background, and how you got to where you are today.
The patient experience has a fairly long history. Throughout my career, I've been working with clients and partners to help them improve, predominantly originally from an operations and engineering perspective, around helping them to optimize and strategize the ways in which they've worked. And the best and biggest impacts that I've found throughout my career have actually been in healthcare and medicine, where we have the ability to positively improve the lives of more people at once. And that's my passion. That's the reason why I actually wrote my book and started Patient Experience Group back in 2019. So now the book's been out for nearly 2 years. Timing is everything, I think some very famous people have said. And during the last 12 months, interest in the Patient Experience Group has grown exponentially, just due to the global nature of the desire to prove that patient experience is that core value that needs to be maintained across the healthcare sector.
Absolutely. And so your book covers a lot of ground, but I'm really interested to hear your thoughts on the digital experience, the digital patient experience, and sort of what are maybe the top three things that are really topical at the moment, particularly with digital transformation happening across all industry verticals.
Yeah, indeed. It is a very important point, and I'm sure that many of your viewers will have had to experience the rise or perhaps reintroduction or improvement of services like telehealth, which is probably the most prominent healthcare-centric digital service that many are focusing on at the moment. But it's not the original. It's not first. It won't be the last by any means. There are a number of other really interesting initiatives that many healthcare organizations look to adopt, whether it be contactless check-ins when we've got check-in kiosks in clinics and hospitals, or whether we've got new and improved digital systems that administrators and back office use as well. But the one thing that does tie all of them together is that strategy around implementation, whether it be improvements or implementation of telehealth or self-service kiosks or new back-end systems. These digital solutions are very important to get right, because the flow-on effects can affect patients very directly, as well as inhibit our staff too.
Yeah, absolutely. Now, I know that in our discussions previously, we were talking about patient data. That came up as a really important element. And I know that you had some thoughts around that as well as, the government obviously wants to retain control of that. Is that the right strategy? Is that what the market is demanding?
Yeah, it's a really interesting question, and something that does pop up time and time again. We see large healthcare organizations from many countries around the world, and thankfully not so many in Australia and the Asia Pacific region, but we see data leakages, we see hackers and cybersecurity threats all the time, and data sovereignty across the IT industry is very, very important, and very important to get right. But never more so important as in healthcare as well. We're talking about our most personal and private information here, what medications we may take, what illnesses we've had throughout our lives, and keeping that data safe and secure is extremely important to every single person that interacts with the healthcare industry. And so getting these things right from the front line, whether we're talking about an independent GP or independent clinic, right through to your government-run hospitals and healthcare providers, through to private enterprise as well, research labs. all of these organizations, as well as us as individuals, play a part in getting that cybersecurity and those digital implementations and the usage of those digital implementations right.
Absolutely. And so when you go out and speak to one of these healthcare providers, what is your standard process? Like how do you get the conversation started and then engage to be able to put these strategies in place?
Yeah, it's a very good question, very interesting in that often healthcare organizations, healthcare providers will reach out to us at the Patient Experience Group with a need, whether they have a burning desire to improve and to bring the patient back into the center of their sphere, or whether it is because they have had a problem and they have a burning need to fix that problem and make sure that it doesn't happen again. And so when we engage with healthcare organizations, when they reach out to us, it's either proactively or preemptively, or it's because there has been an emergency. And those two pieces are often not necessarily what they seem.
Yes.
And we help these organizations really unpack that problem that they're trying to solve, whether it be an improvement or it be a fix to something that has gone wrong. And we get right down to the real root cause as to why there has been a patient experience failure, so that we can not only help them to strategize about the future of that patient experience, but then help them be guided through that transformation effort, whether it be over 1 month, 3 months, right up to 3 years worth of engagements, to really make sure that they are doing the right things for their patients. And the biggest problems that these solve are very traditional problems, as you mentioned earlier, David, around growth or symptoms of things like long waiting times in healthcare. We've all experienced those.
Mm.
And tackling the problems with patient experience will help solve all of those things around profit stagnation, around growth in patient numbers and profitability, or surplus when we're talking about not-for-profit and government organisations, as well as improvements that are more direct and visible to our patients, like a reduction in waiting times, like an improvement in survey results. And getting to the bottom of those measures and how we're understanding those measures is really the key for us.
Yeah, absolutely. And the things that you've just mentioned, patient waiting times and positive responses on surveys, they're all very much customer focused. But do you find when you go out and talk to these organizations that it's like, I need to reduce costs, or I need to get more profit in this area? So it's really not a customer focus, it's a business focus.
Yeah, that is actually a very interesting point. And this is where many of our conversations start, because we find, especially in private enterprise, that healthcare organizations have a statement, a mandate, a value, a poster that they have on their wall that talks about finding the balance between patients and the organization. But a really interesting point that we work through with many of our organizations, many of our clients, is that if we were giving our patients everything that they needed, the way that they needed it, how they needed it, would they really be seeking an alternative? Would we really need to be finding a balance at that point? Or would we have a stable customer base where our profitability would take care of itself, where our growth would take care of itself? And we point to other sectors as examples of where that has been the case, as well as a number of case studies that we've produced over the years in doing this type of work as well, where we know that if we give patients exactly what they want and how they want it, they won't engage a different provider, and the growth will take care of itself. Profitability becomes a side effect of running a great business, a great healthcare solution. And it all comes back to understanding our fundamental purpose of why we're actually helping our patients keep healthy in the first place.
That's great. And if they want to get a copy of your book, how do they go about it?
Yeah, really simply, head over to thepatientexperiencebook.com.au, or very simply, patientbook.co. And if you are a senior healthcare executive that is looking to do some transformation, pop your details in and my team will make sure that a book gets couriered over to you. It is a physical book. It's not an ebook. We don't publish the ebook because we feel that this is the best way to make sure that the message gets held and cared about in the same way in which we want the care for that patient to be promoted as well.
Yeah, that's great. It certainly is a riveting read. I loved it, and it's written in terms that even a layperson like myself can understand. So really appreciate that. Thank you very much for your time today, and best of luck.